to say, press my little button here, be recorded. I'm just going to give a brief overview of our time together today and do a recap of why Monica and I have joined you here since April. We're going to continue to kind of practice this reflective approach that we're offering, and then give you a moment as a council at the end of our presentation to reflect on how it's been to use a reflective approach together as a council. So I want to just express some gratitude for inviting Monica and I here to offer you this reflective approach. And it has been interesting for us to work with your colleagues to try to make this as meaningful as possible for you as a council. Our goals were to bring a reflective approach to the council to help you think together about how you as a interconnected agencies and system can slow down, think together, and be mindful about how you're supporting families and children in your community. So since April, we have been attending the meetings and offering one way to think about the material you share here with each other, the presentations that are brought to you, and if it's supportive of what you do. So I want to share with you a beautiful infographic that some of you have received that Monica designed. And this is kind of what we've been talking together about since April, this three-pronged process of reflection. Reflection in action, what happens, what comes up for us in the moment when we're hearing something. What am I thinking? What am I feeling right now? What other questions might I have? Reflection on action. So when we come together, maybe in small groups or with one other person and think about the material. And some of these questions look similar. And then the last part is, what do we do next? What are the next steps? And as a council, how do you come together and think about what should happen next as a council, as a group of agencies that come together that want to support children and their families? So you all have this beautiful infographic now that you could probably print out if you wanted to and put it in your wallet or your back pocket if you ever need it in another meeting. But it's something we designed for you here, and we hope that it's useful to you. I'm going to review some of the slides that we looked at last time we were together that Mike showed us here around the declining enrollment. And we're going to focus in particular on the slide for Monterey County and offer you another opportunity to get into small groups and think like, what does this mean for your agency? What does it mean for you as a council? What does it mean for your community? So I will share about 4 or 5 slides that we have chosen that might be interesting to you to think about as a group. Please slow me down or stop me as I go through these. You should all have, I think you all got these before our meeting today. Just one second.
Can everyone hear Tala okay? Just wanted to make sure.
Can you not hear me?
A little garbled at times, Tala.
Oh. Sorry about that.
So as Tala's figuring that, just while you're looking at the slides again and thinking about them on that handout, that first reflection in action, those are the questions we'd love for you to kind of think about as Tala shared.
As I share the slides, I would first notice what comes up for you in the moment as we go through the slides again, and you are looking at the content. And then when we get into our small groups, you'll have an opportunity to think together about what this means for your community. Okay. So here is some of the slides that were shared with us, and I'll just kind of highlight some points that I thought were interesting, and please let me know if you want me to slow down. Here is what's projected for Monterey County. Here's where we are right now. And although there's a proposed slight increase, there is projected quite a decline. So here's a look at Monterey County enrollment. Here's another way to look at the same information. We continue to see these changes as enrollment changes for kindergartners. Here's the information again. We have the charter school enrollment information included. And we see the same kind of trend here, the declines in enrollment. We wanted to bring back the slide on the subgroups and have you reflect again on the greatest declines here. We see that the foster care, foster youth are really showing a pretty big steep decline. And I think what's also noticeable that I remember Mike saying is that you'll see the Latin American community not represented here, but they didn't actually show the same type of decline as some of these other community members. So I think that's something to hold and maybe to even take a minute now and think about what you're thinking about or what might come up for you as you hear this information. I'm going to stop here and invite Lori, who I think has some more information around the foster care numbers. Lori?
Yeah, thank you so much, Tala. And so I think that Myra has a few slides for the foster care population that Laura Neal, who is our child welfare director for Monterey County, can speak to. One of the things that I will just preface as Myra brings up the slide is that we have seen a decline over the last decade in foster care numbers overall statewide. I will preface that conversation with saying, although we've seen a decline in the foster care population, we have seen an increase in a lot of the mandates around that population. But Laura can speak to some of the declines, some of the things around continuum of care with the foster care population. I will just caution that although you see a decline in the foster care population, that does not suggest that the children who were in foster care are not present in our population. But if they have left foster care, they're no longer included in the foster care count. They are just included in the overall general population. But these kids continue to be present in our overall education system. So Laura, can you speak to these slides?
Yes, thank you. Hi, everyone. Good afternoon. I do just want to mention real quick something that Lori just described. We have what's called a voluntary population that gets served by FCS. Those are kids that are still living with their parents within their communities, but it's an open case to us. And we work very, very hard to keep those children in their homes with their parents. That's a secondary prevention efforts. So we have 436 total population of children that we're serving. That includes the voluntary population as well, as of May this year, compared to 328 last year. So we're seeing an increase in our voluntary population because we're doing more preventative efforts at the front door. So I just wanted to summarize that number. So to substantiate further what Lori just said. So you can see in these slides too that as Monterey County has dropped population, so has the state of California population has dropped as well overall in foster care. Now, January 19 to December 19 was pre-pandemic. And prior to this year, numbers were overall going down because of the more prevention efforts at the front to keep kids in their communities. And that's true for child welfare. So you can see in Monterey, we had 150 children enter in the year 2019 versus California. And then can you go to the next slide, please, Myra? And then this next slide is getting us into the pandemic. Right. And so we knew it was very eerie, scary for child welfare here in Monterey, across the country, because we knew kids were being hurt, but it wasn't being reported. Those first 7 months of the pandemic, our hotline had a couple calls, right, a day, when in reality, there are hundreds of calls that come in. So the numbers continued to drop. We had 92 that entered foster care in that year compared to California, while those numbers were still dropping as well. And then the next slide of 2021. next slide, you can still see then the continuing decrease of children enter. But our hotline, so in our hotline numbers go right in sync with our teachers, right? So we always have a high number of referrals that come to our hotline in the month of September. Teachers are back in school with the kids, they're seeing the children enter. We had over 540 referrals to our hotline the month of March this year because our teachers were getting ready to go on spring break. And then again, this past month, we had a high number of referrals because the teachers are out for the summer. So the referrals ebb and flow by our mandated reporters as well. So I just wanted to mention that. And so then the next slide. And so overall, you can see that Monterey County, our entries into foster care decreased by 52.6% from 2019 to 2021, which is significant. And then versus the state of California, 22.7% decrease. And just so everyone knows, to put context into the state of California versus the rest of the country, LA County makes up for 1/3 of all of the child welfare population for the whole country. So those numbers are always a little skewed when you look at California versus Los Angeles versus the other counties. So those are the entries for Monterey Family and Children's Services. You can see that they're continuing to decrease, but our voluntary families are increasing, which is good because that means we're keeping children in their communities, in their homes with their parents and their families. Is there anything else, Lori, that I needed to, did I cover everything?
Yeah, no, I think you did. And thank you, Laura, for that brief overview. And I think we can turn it back to Tala and Monica.
Okay.
Unless other people have questions.
I had one question about the total overall number of children in foster care now then.
Oh, total number right now is 283. We have
For Monterey County.
For Monterey County, right now, this day, I checked this morning just to give you really accurate data, 283 children in foster care. That includes our non-minor dependents as well, those kids from 18 to 21, versus we have, I'm sorry, I reversed it. 236 this year versus last year, 283 for the month of May. Okay. So our foster population has dropped by about 50, but remember, we've seen the increase in our voluntary population.
So and the voluntary population, I just want to reiterate, those are still children and families that are in our overall caseload count, but we were able to serve those families without removing children from their homes. So although we are providing supervision and oversight, we are doing that with the children remaining in their family home.
And that's about 100 children. And those are high risk cases. Those are children that have significant safety threats and potential risk factors, but we want to keep children in their families, in their homes, in their communities, because that's what's best for children. When we bring kids into foster care, it increases the trauma to them. So, and there's a huge push in child welfare, California, nationwide, to do more prevention services, because we recognize that as a profession, it's not good to bring kids into foster care, but we have to at certain times.
Thank you, Laura.
Answer your question, Francine?
Yes, thank you. Sorry, I'm eating and saving you guys from seeing that.
I'm about to do that too.
It's about that time of day where, yes, sustenance is important too. So as when Tala had initially showed you that graphic, which I'll bring up and you all have as well now, we were hoping that as you were hearing from Laura some of these details on foster care, and as you were hearing from Tala on reminding you some of Mike's presentation from last time, just reflecting on what are you thinking, what are you feeling. And so now we're going to have a few minutes to go into groups that are facilitated. So Tala, Beth, Francine, Sonia, and I are all going to take a group each. And in that time, we invite you to think about some of these same questions, like what other questions do you have? What does this make me curious about? What biases might I have? What might another perspective be? And what comes up for me as I hear this? So if you could, we're going to ask you to kind of stay on those questions. And I was sharing with the facilitators that part of it is keeping on these questions and part of it is not jumping to And what's the solution? What are we going to do about it? So if we could stay in this reflective space just during these next 10, 12 minutes, and about both, about the foster care information as well as the information from last time that Tala had shared. So are there any questions before I open up breakout rooms? Okay, so let's do,
Look at, thank you, Myra, the governor's budget and the legislature's budget, which I'll talk about in a little bit about why that's important. There are two different phases to our budget, and talk about that a little bit. And then I have a lot of experts in the room, so I can't speak to all of it. So I'm doing a very high level discussion, but what I understand from the state budget. And then we have experts in the room who will help me, like Elsa, like Todd, like Francine, others in the room, who will, and like, oh, well, Denine's not here anymore, but other people in the education realm who can help shore up what I don't know about what's happening in the state budget. So, but it's a good, and we have very little time, so I'm going to try to speed through. I have a PowerPoint presentation that gives a really high level discussion, and then we can get into really a interactive discussion. So I'm going to share my screen. Let me find. I always get screwed up here. I'm going to find my presentation. Okay. Let me try again. I thought I had it all. Oh, okay. Show all windows here. Give me a moment. All right. And can you guys see my slides?
Yep.
All right. So this is my best attempt to summarize what I understood from the California state budget for 22-23. So the budget process. First of all, the governor released his preliminary budget in January, and then we had a May revise that happened around May 13th. And then an interesting part of the process is both houses of the state legislature have considered the governor's May revise, and they actually voted on their own version of a budget packet. And part of that process includes that the legislature needs to decide and vote on a budget by June 15th. And so, and both houses have done that. They have decided on a package. They have negotiated with each house, and they have a package that will then go to the governor, because his May revise doesn't match with the legislature's package. So after June 15th, they will start negotiations between the governor's office and the legislative leadership, with the aim of having a finalized budget for the most part by the end of the fiscal year. Now, I will say there are some major pieces of the budget that won't be finalized by June 30th. But for the most part, we think that we will have a budget package by June 30th with maybe some outlying issues that still need to be resolved, which will probably happen somewhere in early July. So some of the takeaways that I had was, at least for 22-23, the economy remains strong. We do have this issue about state appropriations and what we call a GAN limit, which is a state appropriation limit. And that really has to do with if state taxes and revenues exceed what we thought in our budget, the state has to figure out how to resolve that issue, because it could be something that is problematic for the state. So there are a few ways that that could be resolved. Some might be, and I think that this is how the legislature is looking at this, some state rebates to resolve that issue. The state could decide, maybe we send some, and I think this is very unlikely, additional funding to the counties. And then that could create some other GAN limit problems for local entities. But for right now, this year, I think we're good. Next year and the following ensuing year, we might have problems with the GAN limit. So the forecasting for our state budgets indicates that there may be challenging times for us, not this year, but in the ensuing years. And overall, we're looking at a total spending of just about $300 billion. And we have record reserves, which is estimated to be 37.5 billion in reserves. So I will say that for our budget, a lot of our budget, just like our county budget, a lot of it's focused on one-time allocations. So, you know, we see good news overall. We're getting a lot of investments in the state, but only 9% of those investments are ongoing. So part of this package, there's about 8 billion in relief because of the high gas prices and inflation. So this is called Better for Families rebate. There's some targeted tax relief. And then there's some small investments for small businesses and nonprofits. And then we have another category that's called transformative investments. A lot of money in this. Some of it's around historic infrastructure. Some of it's around ongoing discretionary funding for schools. I'm so sorry that Janine isn't here to be able to talk more about that. Big news, Medi-Cal for all, regardless of the immigration status. And there are several categories about that. There's increased CalWorks grants, investments in childcare systems, and climate and energy packages. And then this concepts about the care court, which is really focused on people who are homeless, who also have behavioral health care needs. I will say this is an area that probably won't be resolved by June 30th. There's a lot of discussion about the care courts. There are still a lot of discussions about what that looks like, who that includes. So I think that we put a pin in that. It's a big initiative for the state, probably won't be resolved by June 30th. And then there's a lot of discussion about TK through 12 education. So there are investments in local control funding, universal after school and expanded learning opportunities, discretionary block grants, career and college readiness, transitional kindergarten, and this is exciting for me, you know, investments in arts, music, instructional materials, and library block grants. School facilities, transportation, and school meals. So they're really looking to advance, to expand school meals in the education program. Some other educational highlights: childcare, pandemic response and infrastructure, workforce and development block grants for childcare, and investments in higher education, student housing, and other reforms. Human services, there's investments in the master plan for aging, because we know that our population is growing older. So there are some investments there. There's some investments in resource families and foster youth. We talked about that earlier. And then also workforce for regional centers for those who are experiencing disabilities, and also addressing disparities for the developmental service system. And also expanding services for the CFAP program, which really funds our food banks. Health services, Elsa will talk about that quickly, either now or later, but there are numerous initiatives around the healthcare area, including protections for reproductive health access, Medi-Cal expansion, behavioral health bridge housing, health infrastructure, and youth suicide prevention. We have health equity and racial justice funding. There's a set aside for that. Special needs, I'm sorry, that was supposed to be special needs dental health clinics. There's some reduction in share of costs for seniors for Medi-Cal, and continuous Medi-Cal coverage for children ages 0 to 5. And then we have housing and homeless services. There's some funding. I will say it sounds really exciting in the governor's budget and the legislature's budget, but these encampment resolution grants are competitive. It requires you to apply for them and figure out what ready programs you might suggest. There's numerous affordable housing grants that are available. The governor and the legislator have put in some funding for legal aid for eviction protections. And there's this new piece around California Dream for All, which is for first-time home owners. And then in public safety, there's set aside for crime reduction, peace officer wellness and training, public safety infrastructure, support for victims of crimes, internet crimes against children's task force, and reentry housing. And then other issues are labor and workforce investments and resources and energy investments. For the county, our budget hearing started on June 1st and 2nd. Then the budget included numerous one-time investments. A lot of our budget solutions were one-time funding, and our budget adoption is scheduled for June 21st. And because I'm taking a little bit of personal privilege as the chair, and my bailiwick is social services, for us in social services, it maintains our current service levels and investments, added supports for child welfare staffing, added supports for homeless outreach services, and increased the in-home support services, wage, and health care benefit. So I know that was a lot, and I know I asked Elsa to chime in terms of one of the biggest pieces in our budget was around health. And Todd is here to talk about, public safety, but I wanted to pause here and let Elsa share anything around the health realm, and Todd about public safety, or Janine or her delegate.
Thank you, Lori. I mean, I think you hit the high levels in terms of additional investments by the state in some of the areas that have raised, right? Like there's quite a bit of money allocated for suicide prevention, ranging from studies to education, et cetera. I think what I will just add to what you said is that there's really this focus on, you know, healthcare as a right and really expanding access to Medi-Cal for individuals that are not eligible, which I think helps to improve, you know, an individual's well-being, a family's well-being, and then the community's well-being. So we have to applaud our governor and legislature for being so bold in using state dollars to fund those individuals that are not able to receive insurance. I think another big element in the governor's budget is really the need for workforce development, whether that be paying for people to go to school, whether that be helping with loan repayments if people provide service in certain communities where there's a greater need for them, a huge investment and expansion of community health workers across a variety of health topics. How exactly all these dollars are going to be made available to local entities is, you know, still yet to be worked out, but a huge focus on kind of building your own and really building the workforce that we need to better serve our children and families and community. Another one that I will say is a couple of years ago, the governor did promise that he would provide ongoing investment for core public health infrastructure rebuilding. You know, we all saw across our own county and the state and the nation just how lacking our public health infrastructure was to be able to quickly respond to a pandemic. So ongoing, there'll be $300 million allocated for core public health infrastructure, $200 million of that going to local health departments. So we expect to receive an allocation anywhere between $2 and $2.5 million of ongoing dollars to really rebuild our public health workforce and infrastructure. I think what I'll pivot to just from a local, obviously ongoing funding for COVID response, because sadly it's still here with us. I'll pivot to really quickly is one budget augmentation that the health department submitted to the board was seeking $250,000 to further support our sexual assault response team efforts. That was granted. Unfortunately, it's only one-time approval, so we will be right there again next spring asking for that funding again, but hopefully it could be from an ongoing pool of funding, not just cannabis assignment, which is how it's being funded. So I think that'll be a great thing for us to be able to make sure that we have those services for our adults and our children in partnership with Natividad available here locally for survivors of sexual assault. So I think those are the big highlights that I'll add to Lori's overview.
Thanks, Elsa. And then Todd, do you have anything to add in terms of the public safety and justice area?
Nothing specific. I think, you know, everybody's kind of heard the governor's, you know, proposals for the like the task force to combat, I don't know what it's called, organized retail theft, you know, the smash and grabs, things like that. Those are the things that grab the headlines. Everything else was pretty status quo as far as probation goes. The big elephant in the room, I think, will be care court. That's more probably Elsa's domain, but you know, she also talked about the infrastructure, and care court would be on top of that. So I mean, in my mind, we need to fix the infrastructure before we add things, especially things that the county is going to be held accountable for, because if we don't deliver the services, my understanding is that the counties are penalized. And Elsa, I don't know if you have any more on that.
Yeah, correct. And I will just say before Elsa responds that there's been a lot of conversation about that. And that's why that probably won't be resolved by the end of this fiscal year, that it'll probably be sometime in the summer. But from what my understanding is that they understand that there's a lot that's amorphous about that issue and about who's, you know, responsible for what, and it's still developing. One of the things that seems really clear to me on the state budget is that it will probably be a phased in approach that all counties won't implement at once.
And that's what I'm hoping, that they'll stand up a pilot and let some of the bigger counties, you know, try it out to see if there's any value to it. Because I think in concept it's good, but I mean, it's very complex to stand up a new civil system.
Right.
And I'll just add to that, sorry, that the solution is getting somebody housed. And so it's not that we don't try to get people housed these days. It's just there isn't the infrastructure set up or the capacity to be able to get people housed. So it's, you know, we, the county, through behavioral health, will be penalized if we don't get somebody housed, yet there's nowhere to house them in our own county or even across the state. So I think it's like with Todd, I think it's a good concept to provide an alternative means of trying to get individuals through a different court who may need additional supports to be able to help them navigate the complex systems that we've created and designed, but there has to be that available housing stock. And so there is money, right? And some of our local jurisdictions have applied for Project Home Key funding and have received it. And there is renovations again of existing hotels, et cetera. But we need to kind of look at it more globally in terms of just how do we as a county add more stock?
And much more is needed. I mean, you know, it's great that like our county was very successful in getting some, you know, a few home key, you know, projects approved, but much more housing stock is needed to be able to respond to the needs. So I'm just agreeing with you, Elsa, that, yeah, you know, it's one thing to order services. It's another thing to have places to have people housed. So I know that Deneen's not here. I don't know if anybody else can speak for education. There's a lot of investments for education, but a lot of it is infrastructure or legislative reform. So I think we'll have to see how that plays out. Okay. Hearing nothing, anybody have any announcements? I'm sorry to race through this, but we did want to have that discussion, to just say what's on the, and by the way, I will say, I would be remiss not saying, there were significant, you know, investments in terms of, you know, recognizing childcare as a need for everybody. So there were reforms in the area of childcare and pre-K and TK. So I didn't want to be remiss in not mentioning that there were some investments included in both the governor's revised and the legislative package. And by the way, the legislative package went a little further than the governor's revised.
Yeah, thank you for including those, Lori, and we'll have more analysis because like I put in the chat, so those numbers look big, but we get like 1% of whatever it is.
Right.
And we only have licensed childcare available for 26% of our children right now. So it's great, as Supervisor Lopez says, it's more than a little bit more in the bucket, but it certainly is not totally filling the bucket yet. And so we still got ways to go, and it's much better than a kick in the pants. So we're excited about that. And I think the community is one where, you know, the PK is great, and we need to make sure that we're not biting off our nose to spite our face in terms of the 0 to 3, in terms of the infant toddler. So there's work going on in the overall community space to try and really rejigger some of those folks who've been supporting the 3 and 4-year-olds to do the 0 to 3. And so there was some recognition of that in the governor's budget, and more work needs to be done in that regard, just to make sure we're holistically holding all of our children and all of our workforce so that we don't siphon those off to go to the school system because they're not being equitably paid at the lower level. So we're excited and excited at the same time.
Thank you, Francine. And then just to not be remiss about it, but there is a ballot initiative too that speaks to the 0 to 5 population for, you know, childcare. And so I just wanted to make sure that's separate from the budget. It's a separate ballot initiative. Just wanted to make everybody aware that that's something that's working through, you know, the ballot initiative as well. That got, I think, a lot of support. So any last things, questions, announcements? Because I know our time is short. I'm sorry, this was a really jam-packed thing. I think it was well worth the conversation. Anybody have any last minute announcements? Did we just wear you out? I think so. Okay. Well, you know what? Great meeting. Thank you guys for being here. I will say that our next meeting is scheduled in August because we have our kind of executive advance meeting. August, we're still trying to figure that out. We might need to meet virtually to just approve AB 361 to continue to meet virtually. So I may need you guys to just log on for a few minutes to approve that so we can continue to meet virtually. Otherwise, we would have to meet in person. So just a heads up about that. So please, 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 we will need a quorum in August for that, okay? Otherwise, oh, actually, July for that, but I don't know. We'll send you a notification. But otherwise, thank you guys. It's been a great meeting.
Have a great